Right, let me ask you something. How many years have you been intimate with your partner? 10 years? 20? Perhaps even longer? And yet, if I asked you to describe exactly what brings her the most pleasure, could you answer with absolute certainty? Most men cannot. And that is not their fault. Nobody taught them. Not their fathers, not their schools, certainly not their GPs. I have been a urologist for over 25 years now, and I can tell you that this gap in knowledge affects more relationships than most people realize. I am Dr. Amelia Wright, and today we are going to have a proper conversation about something that matters enormously, but rarely gets discussed with the seriousness it deserves. I am talking about female pleasure, specifically the 3 techniques that can transform intimacy for couples, particularly those of you who have been together for decades and want to rekindle something that may have faded over time. Now, before we crack on, let me share something that happened in my clinic just last month. A gentleman came to see me, 72 years old, married for 48 years, to the same wonderful woman. He sat down, looked rather embarrassed, and said something I have heard hundreds of times before. He said, "Dr. Wright, I feel like I have been getting it wrong all these years. My wife never complains, but I can tell something is missing. I just wish someone had explained these things properly years ago." That conversation stayed with me, because he is not alone, not by a long stretch. The research tells us that approximately 75% of women require direct external stimulation to reach climax. 75%. That is 3 out of every 4 women. Yet most men, regardless of age or experience, have never been taught the physiology behind female arousal. They have been left to figure things out through trial and error, often with mixed results. So today I am going to share 3 proven arousal techniques based on how female nerve pathways, circulation, and brain chemistry actually function. These are not tricks I have read about in magazines. These come from over 2 decades of clinical consultations, conversations with thousands of patients, and studies on dopamine, oxytocin, and tactile sensitivity. By the end of this video, you will understand not just what to do, but why it works. And that understanding, I promise you, makes all the difference. Let us start with the first technique, which I call the hood glide principle. Here is the most common mistake I see, and I see it constantly. Men go straight for the most sensitive areas before the body is ready for that level of stimulation. It is like trying to sprint before you have warmed up. Your body is not prepared, and the experience suffers as a result. You see, that particular region of a woman's anatomy contains more than 8,000 nerve endings. Let me put that into perspective for you. Your entire palm, the whole thing, has fewer nerve endings than that one small area. 8,000. That is an extraordinary concentration of sensitivity, which means it needs to be approached with care and gradual engagement. Too much too soon, and the sensation becomes overwhelming in an unpleasant way. The body's natural response is to retreat rather than lean in. So here is how you correct this. First things first, moisture is absolutely essential. Either natural arousal or a quality water-based lubricant. Do not skip this step. Dry friction against such sensitive tissue is uncomfortable at best and painful at worst. Keep a good lubricant on your bedside table. There is no shame in it. In fact, most couples I speak to who have been together for many years tell me that introducing lubricant was one of the best decisions they made for their intimate life. Next, use 2 fingers, or a gentle touch over the protective skin fold, which we call the clitoral hood, rather than the exposed tissue itself. Think of this hood as nature's way of protecting those 8,000 nerve endings from overstimulation. You work with it, not against it. Maintain a steady rhythmic glide for about 45 seconds before you even consider adjusting pressure. And here is the crucial bit. Let her body guide you. Watch her breathing. Feel her movements. If she shifts towards you, that is an invitation to continue or increase slightly. If she shifts away, even subtly, ease off. Her body is communicating constantly. Your job is to listen. Do this abruptly, rush through it, and her arousal will drop like a stone. Do it patiently, with attention and care, and her body will naturally respond and invite more. I have had patients tell me that when their partners finally understood this principle, it was as if they had discovered a completely different dimension to their intimacy. One woman, married for 32 years, said to me with tears in her eyes, "I thought that part of our relationship was over. Now it feels like we are newlyweds again." That is the power of understanding physiology rather than just following some list of moves. Now, whilst you are thinking about that, there is a free educational guide in the description called 5 Common Mistakes During Oral Stimulation. I put it together because I noticed the same errors coming up again and again in my consultations. It explains in scientific terms the most frequent coordination mistakes men make and how to correct them with proper physiology in mind. You can download it below, completely free, and it pairs nicely with what we are discussing today. Right, let us move on to the second technique, which I call the alignment method. Now, I want you to cast your mind back. Do you remember slow dancing? Perhaps at your wedding, or at parties when you were courting. That feeling of being pressed close together, moving in rhythm, bodies aligned, hearts beating in sync. Do you remember how that felt? Do you remember how she responded to that closeness? There is a reason why slow dancing has been a prelude to romance for generations. It is not just tradition, it is biology. That physical alignment, the full body contact, steady motion, and shared rhythm, it activates the same neural pathways in the brain that are responsible for bonding, trust, and anticipation. When you hold her close and move together, her brain releases oxytocin, sometimes called the bonding hormone. It creates a sense of safety and connection that is essential for genuine arousal. I had a patient once, a lovely chap in his late 60s, who told me that he and his wife had not danced together in over 20 years. Life got busy, he said. The children, work, then the grandchildren. Dancing just fell away. I suggested he put on her favourite song one evening and simply hold her. Nothing more. Just hold her and sway together in the kitchen. He came back to see me 2 months later with the biggest grin on his face. He said that evening changed everything. They started dancing together regularly, just the two of them after dinner. And their intimate life, which had been dormant for nearly 5 years, came back with a warmth and tenderness he had not experienced since they were young. Think of this alignment as mature foreplay. It is not performance. It is not about showing off or demonstrating technique. It is about connection. And for those of you who have been with your partners for many years, this connection is often more important than any physical technique could ever be. Here is the practical application. Start with gentle body contact, and you can even do this through clothing at first. The key is building warmth and pressure balance. Let your bodies move together naturally, front to front. Breathe together. There is something profoundly intimate about synchronizing your breath with another person. It creates a rhythm that both of your nervous systems can attune to. Once that rhythm establishes itself, you can guide subtle hip movement. Forward and back, gentle circular patterns. Think of it as relaxed dancing, rather than anything more urgent. This motion increases pelvic blood flow by several 100% and stimulates the deeper erectile tissues, known as the clitoral bulbs, that extend internally on both sides. When done slowly and with intention, this becomes as psychologically intimate as it is physical. The two reinforce each other. Her body relaxes because she feels safe and connected. That relaxation allows blood flow to increase. Increased blood flow heightens sensitivity. Heightened sensitivity makes every touch more meaningful. It is a beautiful cycle, and it starts with nothing more complicated than holding each other close. When she looks up and meets your eyes during this, when you see that softness in her gaze, you will know you are properly aligned. That moment of eye contact, that is when many women tell me they feel most loved. Not during the act itself, but in that moment of quiet connection beforehand. Now, let us address something that came up in a conversation I had recently. A gentleman asked me about safety, particularly regarding oral intimacy, and I think it is worth mentioning here because it speaks to the trust that underpins everything we have discussed. Intimacy of any kind requires trust. When we are talking about oral stimulation specifically, that trust extends to knowing your partner and being honest with each other about health matters. In the UK, rates of sexually transmitted infections have been rising, and whilst this is more of a concern for new relationships, it is worth having open conversations with your partner about health and testing if there is any doubt. The foundation of great intimacy is communication and trust. If you have that, everything else becomes easier. Right, onto the third technique, which I call the broad contact approach. This one addresses another extremely common mistake. Most men focus on precision when they should be thinking about surface area. They have this idea that accuracy is everything, that finding exactly the right spot and stimulating it precisely will yield the best results. But actually, the opposite is often true. Narrow, pointed movement frequently feels too sharp and intense against the most sensitive tissues. Remember those 8,000 nerve endings we talked about? Concentrated, pinpoint pressure can actually overwhelm them rather than pleasure them. What works far better is broad, warm, consistent contact. This sends a fuller signal to the brain's pleasure centers and activates both pressure receptors and vibration receptors simultaneously. Think about the difference between someone poking you with their finger and someone placing their whole warm hand on your back. The single finger might be more precise, but the full hand contact is more comforting, more enveloping, more satisfying. The same principle applies here. So practically speaking, use your entire tongue or the flat of your fingertip rather than the tip alone. Keep your movements slow and controlled. There is no rush. Patience is not just a virtue here. It is a necessity. Cover the full external area before returning to the most responsive points. Think of it as painting with broad strokes before adding fine detail. And as you do this, match her breathing. When she breathes in, ease off slightly. When she breathes out, that is when you can apply gentle pressure. This synchronization creates a rhythm that her body can anticipate and respond to. Here is something else that many people do not know. Gentle humming or low vocal vibration can actually enhance the physical sensation through resonance. The vibration travels through your lips or tongue and adds another layer of stimulation. It sounds unusual, I know, but there is proper science behind it. Modern intimate devices now mimic this exact principle because research has shown how effective it is. Clinical studies consistently showed that these methods help 9 out of 10 women reach climax within minutes when paired with emotional connection. Note that last bit carefully. Emotional connection. The physical techniques alone are not enough. They work because they are combined with the trust, the attention, the care that we have been discussing throughout this video. Now, I want to address something else before we finish. Several people have asked me why their own doctors do not cover these topics. One person said their urologist had never once mentioned anything about female pleasure in all the years they had been patients. And honestly, that is a fair point. Medical training historically focused on pathology, on what goes wrong and how to fix it. The positive aspects of sexual health, the things that make intimate relationships fulfilling and joyful, those were largely left out. That is changing now, thankfully, but many doctors my age and older simply were not taught to discuss these matters with patients. It was considered outside the scope of medical practice. I have always disagreed with that view. Sexual health is health. Intimacy is part of well-being. And helping couples maintain fulfilling intimate relationships, particularly as they age, is absolutely within the remit of good medicine. So if your own doctor does not cover these topics, know that it is not because they do not matter. It is often simply because the doctor was not trained to discuss them. Let me also say this directly to those of you who have been with your partners for many decades. What you have is precious. The intimacy that develops over 30, 40, 50 years of marriage is something that younger couples cannot even imagine. You know each other in ways that go far beyond the physical. You have weathered storms together. You have raised families. You have lost loved ones and supported each other through grief. That history creates a depth of connection that is the envy of anyone who understands what truly matters in life. Physical intimacy changes as we age. That is simply reality. But it does not have to diminish. In many ways, it can become richer and more meaningful. The urgency of youth gives way to something deeper, more patient, more attuned. The techniques I have shared today are not about recapturing your 20s. They are about embracing where you are now and discovering new dimensions of pleasure that perhaps you never knew existed. I had a couple come to see me last year. He was 81, she was 79. Married for 56 years. They sat in my office holding hands, something I always find rather lovely. They told me that after watching some of my videos and having honest conversations with each other, they had experienced intimacy that was better than anything they remembered from their younger years. Not more frequent, mind you, but more meaningful, more connected, more tender. She looked at him with such affection and said, "We finally stopped trying to perform and started just being together." That single sentence contains more wisdom about intimacy than most textbooks. So let me summarize what we have covered today. 3 techniques, each grounded in physiology and designed to enhance pleasure through understanding rather than guesswork. First, the hood glide principle. Begin gently with moisture and patience. Work with the protective hood rather than bypassing it. Maintain steady rhythm for at least 45 seconds and let her body guide your adjustments. 8,000 nerve endings require respect, not assault. Second, the alignment method. Use full body contact and shared rhythm to activate bonding pathways in the brain. Dance together, literally or figuratively. Build warmth and connection before anything else. When her body relaxes into yours, when your breathing synchronizes, when she meets your eyes with that soft gaze, you have laid the foundation for genuine arousal. Third, the broad contact approach. Think surface area rather than precision, and use the flat of your tongue or fingertip rather than the tip. Cover the whole external area before focusing on specific points. Match her breathing and consider gentle vocal vibration to enhance sensation. Patience and consistency trump speed every single time. And underpinning all of this, emotional connection, trust, communication, the willingness to be vulnerable with each other and to prioritize her experience as much as your own. If you found this helpful, I would genuinely appreciate a like. It helps other men find this information, men who might be sitting in the same position as that 72-year-old gentleman who came to my clinic, wishing someone had explained these things years ago. Subscribe if you want to see the next video, which will cover intercourse physiology and timing, specifically how to coordinate stimulation during penetrative intimacy in ways that work for both partners. That one is particularly relevant for couples who have been together for many years and want to understand how their bodies can work together more harmoniously. And do leave a comment telling me which of these 3 techniques you are going to try first. I read every comment, and I am always curious to hear how these principles work in practice for real couples. I am Dr. Amelia Wright. Thank you for spending this time with me. Go and be good to each other. Your relationship deserves it.